Hey guys, it's Nikki here. I am posting this video for Module 2's blog, the Reflective Blog assignment. I completed the Self-Assessment Core Values questionnaire and found that I value family and spirituality more than anything. After reading and watching the video about Jahia's story, I was really sad for her and angry at the same time for her. You know, she went in for this routine tonsillectomy, something that was supposed to be simple, and she was just supposed to go home and recover and, you know, live like a normal 13-year-old, and she ended up bleeding out and just had this horrible experience. Her family is devastated that, you know, they didn't expect any of this to happen. So now their baby is lying in a hospital bed, trached, has 2 feeds going, and the doctors are saying that there's really no brain activity. So this is like very devastating. But I'm also like angry in regards to the fact that, you know, the patient's not able to speak her wishes. You know, her family wants everything done possible for her to continue living, but, you know, does Jahia really want to live in this type of situation for the rest of her life? I think oftentimes medical professionals see the realistic side of things, whereas family members can sometimes see the distorted side of things. You know, they're holding on to anything possible, like any hope. They're holding on to like the littlest thing. So their viewpoint on things might not be very realistic. Like realistically speaking, a patient that is brain dead, which technically, you know, it can go either way. She's not brain dead, she is brain dead. But a patient in a vegetative state, in Jahia's situation, realistically and statistically speaking, these patients aren't going to get up in 3 months and walk out of the hospital and be able to be completely independent, eat for themselves, talk for themselves, walk for themselves. You know, realistically, that's probably not going to happen. Not saying that it won't happen, but realistically speaking, it's not going to happen. So I was sad for Jahia, because most people don't want to live in a vegetative state for the rest of their lives. Most people want to be independent. Most people want to be able to do things for themselves. Most people want to be able to interact with their family, and they want to be able to do what normal 13-year-olds do in Jahia's situation, you know. And she can't do that. She's bound to a bed for the rest of her life, trached on 2 feeds. And, you know, her family's holding on to any type of hope that they might have that she's going to get better. And we deal with that a lot on the inpatient side at the hospital. You know, you see families in denial, holding on to any glimmer of hope that they possibly have. And as a healthcare provider, it's challenging. It's draining. Going to work, and, you know, you're there to have the patient's best interest at heart, and it's very draining to deal with that type of situation. And I think I can speak for a lot of other medical professionals. You know, anytime that we've had these type of situations on our unit, most of the medical professionals are hurting for the patient, because they know realistically the outcome that this patient is going to have. Whereas the family, you know, like I said, is just trying to hold on to any glimmer of hope, and hope that one day they walk into the hospital and their baby's getting better. I did research a little bit more about Jahia's story. Currently, 2017, she's actually still alive. She is living with her family. She's still trached, still bedbound, not able to speak to her family on 2 feeds, which is sad. It does make you wonder, like, if she wants to be like that, I wouldn't want to, but it's hard to not put your personal viewpoints into a situation like this, but at the end of the day, in the back of all nurses' minds, they're thinking that, what what does the patient want? But I did find it very interesting that in the article that the coroner released her death certificate before a decision was even made. I thought that was very odd, very unusual, and I do think that that's probably why this case was in such an uproar, because that's very unusual. The article that I read about diverse workforce, I got from Robert Wood Johnson Foundation. I'll post the reference underneath this video. It's called Why Diversity in the Nursing Workforce Matters. It was written by an RN who does have her PhD, and I'm not going to pronounce the name right, but it's Adejoke Ayula. So in her article, she talks about how over the next 4 decades, minority groups are projected to increase and will eventually outnumber majorities. So in her article, she talks about how it's extremely important for healthcare providers to be culturally aware of different cultural backgrounds. She talks about how this allows healthcare providers to better take care of their patients, which improves patient satisfaction, improves health and also improves health outcomes. So in Jahia's situation, we have to be culturally aware of her family's wishes. Even though we might not agree with them, we're also taking care of them as well. It's very disheartening, but at the end of the day, we're taking care of them too. So the AONE executive competencies that I felt would be challenged in a situation like this would be promote decisions that are patient-centered, simply because Jahia doesn't have a voice in this. We don't know what her wishes are. We don't know if she wants to hang on for her family, or if she, doesn't want to be in a vegetative state and wants to let go. We don't know that. So that I felt would be challenged, as well as creating an environment which recognizes and values differences in staff, physicians, patients, and communities. Simply because, it is easier said than done to accept some patients' families' wishes. So sometimes it can be hard to be culturally aware because maybe our personal views don't agree with what the family wants. So that would be challenged as well. The ANA scope and standards that I felt would be challenged would be the right to self-determination. Just like I said before, Jahia doesn't have a voice in this situation, so that would definitely be challenged, as well as professional boundaries. I feel like that would be another ANA scope and standards that would be challenged, simply because you're taking care of a patient 3 days a week, 12 hours a day, sometimes more. Some nurses work more than 3 days a week. So you get attached to these patients. You're doing everything for them, and you have an emotional attachment to them. And, sometimes you want to stand up for them, and you want to say, that's not right. She's, she deserves to have a good quality of life. Sometimes you want to just tell the patient's families that, but you can't. You have to maintain your professional boundaries, and sometimes that can be hard. So I definitely feel like that would be another standard that might be challenged. And that's all. Thanks, guys.